Good. Good. And there we go.
That big shift in your neck now. So you get adjusted your collar, you're gonna hear a little pop.
How's it going, everyone? I'm Dr. Brian Beard, Advanced Health Chiropractic, and today we're here with our patient Nestor. Nestor's just about halfway through the care plan, and he started off with a very manual labor, physical labor type job, being in 10 out of 10 pain, can't lift, can't do his job properly because he was having a real hard time, especially in that low back. He also had some mid back and neck pain, which we've been able to clear out 100% just halfway through his care plan. Now, we're focusing on the low back today because he's still about 4 out of 10 pain that way, and that's what we're going to be focusing on today. But we're going to do a adjustment for the mid back, the neck, and the low back today. So we do start with the orthostem over top the entire spine, from the base of the skull all the way down in the sacrum, and that helps release some of the tension within the joints before we adjust. Now what I'm going to do is I'm going to palpate the ribs. And we're already getting a lot of pops here, but what I'm trying to feel is if there's a rib out of place. Because if that's the case, then that can cause a lot of pain and problems within the back, and mid-back especially. So we're going to start off with the thoracic adjustment. I'm going to find right there, about T5. Go ahead and breathe in and out. Good. There we go. Good. And here I'm doing a sacral drop, just kind of gapping out a low back and that L5S1 right where he's feeling the majority of the pain. Elbow, cross. There we go. So what I'm going to do is I'm going to palpate right there. Go ahead and breathe in and out. Excellent. Right there. Okay, go ahead and breathe in. And relax that shoulder. There we go. Last thing we're going to do is the cervical adjustment.
We're going to adjust your thoracic spine.
Right there. Right ear to right shoulder.
That big shift in your neck.
There we go.
Your upper back right here. And on your exam,
left ear to left shoulder.
So you get adjusted your collar, you're going to hear a little.
There we go. Okay, 2 for 2. Nice. So we're just gapping those joints out, getting a lot of range of motion into that cervical spine. Okay, grab my elbow. Okay, so what we're going to do today is to do a little bit of soft tissue, specifically Graston release on Nestor's low back. You're going to sit back on your heels like this, and what I'm going to do is I'm going to use the Graston tool. We're going to scrape out anywhere from L5 to L1, kind of that tissue around the quadratus lumborum. Exactly, like right here. And you're just going to stay there for me, Nestor. I'm going to take this tissue. We're just going to scrape it out. And we do this to help alleviate some of that adhesion and scar tissue within the back. And since Nestor's still dealing with a little bit of pain right here, that's where we're going to focus our adhesion and manual release. And you want to do what's called petechial hemorrhaging around the tissue here. What that means is there's very small capillaries in the skin, and you want to press just hard enough to break those, which causes a little bit of redness, but not too much bruising. Now, some docs will go all the way and make it bruise a lot, and other docs won't even make it red. The research is a little bit inconclusive on which one is better, so I go somewhere in between and just cause a little bit of petechial hemorrhaging right around both sides of the spine. When you do this technique, you don't want to go directly over top of the spine because one, there's no tissue that you can really do over top of bone, and two, it hurts kind of a lot, so I want to avoid that area. And once we get it nice and red, scraped it out, I'm going to wipe off the excess, and then you are all set, Nestor. What we're going to do now is show Nestor's traction that we also do to help for this low back pain. So we're going to go ahead and set you up in traction. Beanie's got it from here. Thank you.
Sorry. Okay, so this traction is for Nestor's mid to upper back. So according to his x-rays, his upper thoracic, or his thoracic spine, I'm sorry, I'm going to put it on here. since our spine has gone like this, so what we're gonna do is use this strap under here to kind of pull him back into proper alignment. Okay. When we pull on this, you tell me when it's a good stretch. In that mid back. Good. Okay. So now she's gonna lay here for 10 minutes. And that's it.
Alrighty, so Nestor is hooked up in his traction, he got his adjustment, he got his soft tissue. Now prior to all of this, he did his rehab on the floor over there, which is what we do here at Advanced Health Chiropractic. We incorporate rehab, traction, adjustments, and soft tissue therapies all in one to help get him as better as fast as possible. So if you like that video, you're intrigued by some of our treatment techniques, give us a call or come visit us at 1147 South Wabash Avenue down in the South Loop of Chicago. And if you're watching on YouTube, make sure you like and subscribe and ring that notification bell. We'll catch you on the next one.